When transferring a client, most of the client's weight should be supported by the nurse aides. A. Shoulders. B. Back. C. Legs. D. Wrists. When taking an oral temperature, it is important to A. Place the thermometer under the tongue. B. Put lubricant on the thermometer. C. Place the thermometer under the arm. D. Place the thermometer in the rectum. The first sign of a decubitus ulcer is A. Mottled and cold skin. B. Tender broken skin. C. White and insensitive skin. D. Redness and warmth. The period of heart muscle contraction is called A. Systole. B. Diastole. C. Fibrillation. D. Infarction. To convert 4 ounces of juice to milliliters, the nurse aide should multiply A. 4 by 15 milliliters. B. 4 by 5 milliliters. C. 4 by 10 milliliters. D. 4 by 30 milliliters. When making an occupied bed, the nurse aide should always A. Put the dirty sheets on the floor. B. Keep the bed at the lowest level for patient safety. C. Lower both side rails before changing the sheets. D. Raise the side rail on the unattended side. The equipment you need to gather to do unconscious oral care would include A. Toothpaste. B. Toothbrush. C. Tooth mouth swab. D. All of the above. The case manager for a client requiring home health care is usually done by A. A home health aide. B. A nutritionist. C. A registered nurse. D. A physician. An apical pulse is counted for A. 15 seconds, then multiplied by 4. B. As long as it takes to hear a regular beat. C. 30 seconds, then multiplied by 2. D. 1 full minute. Which statement best describes ADLs? A. Driving a car, shopping, cooking meals. B. Watching TV, sleeping, playing games. C. Bathing, feeding, dressing, ambulation. D. Going to work, having good relationships. Rheumatoid arthritis may A. Have periods of remission. B. Cause deformities. C. Cause pain and muscle spasms. D. All of the above. The admission process includes all except A. Completing a physical assessment by the CNA. B. Weighing and measuring the person. C. Completing an admission checklist. D. Orientating the person to the room, nursing unit and facility. All of the following are signs of approaching death except A. Circulation increase. B. Breathing is labored. C. Low blood pressure. D. Cold extremities. What is the best way of keeping a skilled nursing facility from having an unpleasant odor? A. Keep all the windows open. B. There is nothing you can do. C. Empty bedpans and change linens in a timely manner. D. Use an air freshener regularly. The brain is part of the A. Locomotor system. B. Nervous system. C. Exocrine system. D. Endocrine system. Which of the following should be reported immediately? A. A pulse of 90. B. A blood pressure of 90/40. C. Temperature of 99.4. D. Respirations of 12. A major risk factor for a stroke is A. Hypotension. B. Being underweight. C. Overuse of vitamins. D. Hypertension. Signs and symptoms of shock may include A. Increased blood pressure, bradycardia, and flushed skin. B. Low blood pressure, tachycardia, clammy, pale skin. C. Hyperventilation. D. Absence of respirations and pulse. A normal adult blood pressure is A. 134/90. B. 80/40. C. 180/80. D. 116/70. While taking a rectal temperature, the nurse aide should insert the thermometer and A. Hold on to the thermometer until it can be removed. B. Go on his break. C. Take care of other patients and return in 3 minutes. D. Stay in the room until it is time to read the temperature. The nutrient used to build and repair tissue is A. Carbohydrates. B. Fats. C. Protein. D. Vitamins. Mrs. Jones is an insulin-dependent diabetic. What task should not be done for Mrs. Jones? A. Bathing in warm water. B. Ambulating with a gait belt. C. Clipping toenails. D. Feeding with a plastic spoon. Normal urine color is A. Brown. B. Red. C. Yellow. D. Colorless. The recommended position for giving an enema is A. Left Sims. B. Semi-Fowlers. C. Supine. D. Prone. Wasting or a decrease in the size of a muscle is called A. Edema. B. Impaction. C. Decubitus. D. Atrophy. A bedsore or decubitus ulcer is caused by A. Burns. B. Abrasions. C. Fatigue. D. Inadequate turning. One of the major reasons the elderly person is incontinent of urine is A. The muscle that keeps urine in the bladder weakens. B. They can't tell when they need to urinate. C. The circulatory system is failing. D. They are too lazy to go to the bathroom. Headaches, nausea and pain would be called A. Observations. B. Charting. C. Symptoms. D. Assessment. The physician ordered Mrs. Jones to receive physical therapy QOD. That means that she will go A. 4 times a day. B. Every 4 hours. C. Every day. D. Every other day. The proper temperature for a soapsuds enema is A. 105 degrees Fahrenheit. B. 115 degrees Fahrenheit. C. 84 degrees Fahrenheit. D. 98.6 degrees Fahrenheit. A sodium-restricted diet for heart disease does not include A. Carrots and bananas. B. Pickles and olives. C. Hamburger and pears. D. Fish and potatoes. Diabetes mellitus make a resident more prone to develop A. Infections. B. Cancer. C. Fever. D. Chills. Edema means A. Swelling. B. Decreased appetite. C. Increased appetite. D. Dehydration. If the resident is smoking and the nurse aide needs to take an oral temperature, what should the nurse aide do? A. Tell the next shift to take the temperature. B. Brush the resident's teeth first. C. Wait 15 minutes to take the temperature. D. Take a rectal temperature. When heat is applied to the skin, the blood vessels A. Narrow. B. Constrict. C. Dilate. D. Remain the same. When lifting a heavy object, which muscle groups should be utilized? A. Muscles of shoulders. B. Muscles of hands. C. Muscles of back. D. Muscles of legs. When making a bed. A. Raise the bed to the level of your hips. B. Raise the bed 12 inches. C. Raise the bed to the level of your waist. D. Do not raise the bed. The surgical creation of an artificial opening of the large intestine is called A. A gastronomy. B. A colostomy. C. A pouch. D. A colectomy. When giving an enema to a person, you ask the person to lie on A. Their back. B. Their abdomen. C. Their left side. D. Their right side. Which of the following is recorded as the systolic blood pressure? A. The point when the pulse is no longer felt. B. The point where the last sound is heard. C. The point where the first sound is heard. D. The point 30 millimeters of mercury above where the pulse was felt. When the valves in the legs weaken, it can result in A. Myocardial infarction. B. Cerebral vascular accident. C. Varicose veins. D. Heart failure. Mrs. Harvey complains of abdominal discomfort. Watery stool has been leaking from her rectum. This could be a sign of A. Diarrhea. B. Bowel incontinence. C. Constipation. D. Fecal impaction. What is the normal range of systolic blood pressure for adults? A. 120 to 140. B. 100 to 120. C. 80 to 100. D. 60 to 80. Which function is not done by the circulatory system? A. Transmitting electrical pulses from the brain. B. Removing waste products from the cells. C. Transporting nutrients to the cells of the body. D. Delivering oxygenated blood throughout the body. Mr. Brown has an ankle brace. When you remove the brace, you notice a reddened area on the ankle bone. You should A. Put on 2 pairs of socks before the brace. B. Report your observations to the nurse. C. Apply a bandage to the reddened area. D. Massage the reddened area. A fracture-type bedpan is used for residents who A. Have had hip surgery. B. Are in traction. C. Have a back injury. D. All of the above. A restraint attached to a patient's body and to a stationary object is A. A passive physical restraint. B. An active physical restraint. C. An illegal restraint. D. A chemical restraint. Settings where a CNA can work include A. Hospitals. B. Home care. C. Hospices. D. All of the above. When nursing assistants find equipment in need of repair, they should A. Fill out an incident report. B. Wait for the safety inspection. C. Report it to the appropriate personnel. D. Continue to use the item until it is replaced. Mrs. Allen has a gastrostomy and the nurse just put Ensure through the feeding tube. The CNA needs to put her in which position for the next 1 to 2 hours? A. Dorsal position. B. Fowler's position. C. Supine position. D. Sims position. Food moves more slowly through the digestive tract of older people. What is a common consequence? A. Bowel incontinence. B. Enteric conditions. C. Diarrhea. D. Constipation. What does the abbreviation BID stand for? A. 3 times a day. B. 2 times a day. C. Before dinner. D. 4 times a day. A. The strength of the skeletal muscles. B. The rhythm of the heart. C. The amount of salt retained in the blood. D. The amount of sugar in the blood. Which of the following is a correct measurement of urinary output? A. 1 quart. B. 40 ounces. C. 2 cups. D. 300 cubic centimeters.